With schools back in session and fall sports getting underway, sports injuries will be on the rise. Whether you're a student athlete or a weekend warrior, we could all use tips on preventing sports injuries before they happen. Dr. Bob Kalin is an orthopedic surgeon and the founder of Sport Ortho Urgent Care. It's nice to have you with us. How you doing?
Thank you. Nice to be back.
Yeah, glad to have you. All right, so let's talk about sports injuries. What can we do to prevent these problems before they happen?
Well, the key is being proactive. The CDC reminds us that each year over 2.5 million children 19 and under will go to an emergency department for a sports or recreation-related injury. So the general guidelines would be these. For our youngsters, get a pre-participation physical. You might find something small like Osgood slaughter, but you might find something big like a heart issue that really would be beneficial. 2, protective gear is number 1. At all ages, it has the biggest benefit, a helmet for bike riding and skateboarding. And 3, if you do have an injury, and you probably will, follow the return to guidelines properly. And we all know what the problems of going back with a concussion too early. For the weekend warriors, 2 top tips. Don't try to get a whole week's worth of workout on Saturday morning. Everybody's lives are busy, and just don't fall for that. And 2, by 50, 60, a lot of us have already had an orthopedic injury ourselves or maybe a heart issue. Don't skip working out for that. Just incorporate it so that when you do, it can be effective and not limited. For a specific injury, there's a great program, Stop Sports Injuries by the American Academy of Orthopedic Sports Medicine, and on their website we'll give you specifics. Like baseball, this Tommy John surgery is an epidemic, so they'll tell you how not to throw so many fastballs. So each sport is on there specifically.
Yeah. How do you know when it's time to see a doctor, when those aches and pains would require actual help?
Well, the general guidelines is when it affects your daily living, when it stops you from doing what you want recreationally or vocationally. On a more emergency basis, if you have swelling that just keeps progressing, you can't bear weight or lift something, numbness and tingling that's progressive, those can all be circulatory or things that need emergency treatment.
And the great thing is that we've now got a place that we can go where we can get orthopedic care without having to go to an ER. Tell me about Sport Ortho.
Well, the number 1 visit to all doctors now is musculoskeletal. And with the increased supply of urgent cares, we don't really have the focus that we've had of specific treatment. So the orthopedic urgent cares allow one to get the specific diagnosis and therefore the treatment plan for those injuries without going to the ER and spending a lot of money.
Yeah, so you're seeing a specialist who knows, what they're looking at.
All the staff in these urgent cares are trained. They're orthopedic PAs. They have to do a few month fellowship with me afterwards. All the x-rays are reviewed. They're all digital. And then they're backed by orthopedic surgeons in any emergency condition. But again, they're cost effective with the proper bracing, splinting, casting, so that you can get the right diagnosis the first time. Plus there are windows of opportunity that are missed if you're just not up on your game that may actually hurt a child by taking a treatment opportunity away. So we try to not miss those.
Okay, some great opportunities for us then. Thank you so much for being with us today.
Oh, my pleasure.
We appreciate it. There are 6 Sport Ortho Urgent Care clinics in our area. If you'd like to find the one nearest you or for more information, you can visit their website. It's sportorthourgentcare.com.